Governor Morrisey started off day 2 with a list of executive orders, and among those, he signed a letter to the congressional delegation declaring fentanyl as a weapon of mass destruction. Shelby Burrow is joining us on what this could mean for West Virginia.
This is legislation that Governor Morrisey has been vocal about since 2022, when a group of 18 attorneys general came together and introduced a bill into the U.S. House of Representatives aiming to declare fentanyl a weapon of mass destruction.
I am asking our West Virginia congressional delegation to work with me and for them to advance policies that list fentanyl as a weapon of mass destruction.
A weapon of mass destruction is defined by U.S. law as a destructive device, a weapon that is made to cause death or injury by using toxic or poisonous chemicals.
Fentanyl has ravaged our state and killed so many people. We've all been working very hard fighting the drug plague, but I think we need additional help.
Treating illicit fentanyl as a weapon of mass destruction would allow the Department of Homeland Security, the Drug Enforcement Agency, the Department of Justice, and the Department of Defense to work together to administer more resources with the goal of preventing the distribution and production of fentanyl.
It used to be that we'd be able to talk about the number of pain pills that are in the system. Now we're talking about the volume of fentanyl that's out there, and of course that's slaughtering our citizens. We have to get our arms around that.
According to the Drug Enforcement Agency, in 2024, half of all pills seized and tested by the agency contained a potentially deadly dose of fentanyl. Dr. Dorothy Van Oppen recently spoke at the Hope Drug Summit about seeing the neurological impacts of fentanyl.
Just know from a medical perspective, fentanyl is a pharmaceutical and has medical indications. In terms of the addiction world, I mean, when it's the illicitly manufactured fentanyl in large quantities that is really impacting, for our opioid overdoses and addiction, and really devastating.
Dr. Van Oppen feels this legislation could spark confusion on the different types of opioids out there.
I think it might muddy the waters because I think they're different things. So saying that which is, it's a chemical compound medication, there are actual indications for it that we use in medicine, for example, in anesthesia. But then, I think that's a different thing than illicitly manufactured.
According to the data from the state's Department of Health and Human Resources, significant progress in decreased overdose deaths had been made. And the data showed a 36% decrease from January to May 2024. U.S. Attorney Will Thompson has been adamant on attacking the opioid epidemic by using a multifaceted approach, tackling the supply side and the demand side.
I don't disagree with him. Fentanyl is horrific. It's a horrific problem. It's tearing our families, communities apart. To understand the potency of fentanyl is incredible, and the devastation it's causing, it is certainly causing a lot of disruption and destruction in our communities.
Governor Morrisey says this congressional letter is among the topics that are most important to the framework of his administration, and he will likely work with the incoming Trump administration to address it. In the studio, Shelby Burrow, Eyewitness News.